Hi, this is Sam. Sam is having surgery at Mass Eye and Ear today. She'll be sharing her experience to help others understand what a surgical day is like here. Upon arriving to the pediatric floor, Sam checks in. Her parents are asked to provide ID for confirmation and then are given ID bracelets to wear. They will also be asked to sign paperwork to confirm information. The nursing staff weighs Sam. Her ID bracelet will match mom and dad's to ensure safety that those with Sam are her guardians. Sam's vitals, including her oxygen level, heart rate by pulse oximeter, and temperature, are taken and recorded. Sam's surgery requires an inpatient room to recover for observation. Some patients may not require a room if it's a quick recovery of 2 hours or less. In her room, mom goes through a bag that the hospital provides, which includes socks and PJs. Scrubs are also provided for one parent to change into, so mom or dad can accompany their child down to the surgical floor. As Sam gets dressed, mom talks with the nurse to go over Sam's history and answer any questions. There is usually time for play while waiting for surgery. Sam finds the playroom filled with many toys and crafts to do with a volunteer. Once Sam is called to come down to the surgical floor for her operation, the nurse gives her Tylenol to help with any discomfort following surgery. After Sam takes her Tylenol, she and mom are brought down to the S floor to meet her surgical team. When Sam arrives, she is brought to the pre-op holding area, where there will be a bed with wheels and a spot for her and mom to wait. They will meet many people. One will be the anesthesiologist, who will listen to Sam's heart and lungs to make sure she is well for surgery, as well as go over paperwork and consent with mom and answer any questions and concerns. Play and preparation will also be provided by the child life specialist to help keep Sam calm and distracted while waiting. An operating room nurse will come by for safety checks for Sam and mom and to confirm what they are expecting for surgery today. The child life specialist or nurse will explain to Sam how she will receive anesthesia for her surgery. For Sam, as she is still young and small enough, she will breathe the anesthesia from a soft mask that goes over her nose and mouth. The anesthesia air has a strong smell, so Sam can choose a flavor to send her mask and medicine. In the pre-op area, Sam's surgeon comes by to say hello and make sure mom has no additional questions. Once the whole surgical team has come by to say hello and goes over all safety checks, it is time to go into the operating room. It is important to note that every operation is different and certain surgical attire requirements may vary. Mom carries Sam, who brings her favorite blanket from home, in with her. When Sam gets into the OR, she is greeted by more staff. There are a lot of machines, bright lights, and tables. Mom is guided to sit with Sam next to the OR bed. She can continue to have fun with the iPad. The anesthesiologist will decide the most appropriate position for induction. For Sam, she is able to sit on her mom's lap, but other children may sit on the bed or lay down. This is for the safety of the child, parent, and team. When it's time for the anesthesia mask, Sam is a little unsure about the mask, but realizes it doesn't hurt. As Sam breathes the air and starts to get sleepy, she becomes a little restless. This is a normal response to the anesthesia. Sam is now under the effects of the anesthesia, is unaware, and will not remember. The team safely transfers Sam to the OR bed, where they take over to make sure she is safe and to continue with the procedure. Mom is escorted out to where she can wait. Once Sam is brought to recovery and it's safe, mom or dad, or sometimes both, are brought back to join her as she wakes up. Depending on the child's surgery and how busy the recovery area is, the nurse will decide if one or both parents can come in. During recovery, kids can wake up feeling groggy. Sometimes kids can wake up crying and agitated because they feel funny. This is normal as the anesthesia works its way out of their system. Other times, like Sam, they sleep it off and wake up when they are ready. Parents are prepared for both scenarios, as it can be challenging to see your child wake up in a confused state. Sam has a popsicle to help her throat from feeling dry and sore. In the recovery area, Sam has a pulse oximeter on to monitor her breathing. She also has an intravenous that was placed after she was asleep. This hydrates Sam and gives her the nutrients she needs. It's also there in case more medicine needs to be given. It does not hurt her and she can still use that hand. Her surgeon also comes by to talk to mom and dad and let them know how well her procedure went. It is time for her to go back up to the pediatric floor. There she is greeted by dad and her nurse. If Sam meets the criteria for discharge and continues to drink and feel better, her IV can come out and she is allowed to go home.